Hey Ontario seniors, Doug Ford is the worst to older people living in Ontario. Here are just a few of the reasons why. Doug Ford has called a snap election in Ontario for February 27, 2025, just a little over 2.5 years into his second term. He's doing this to suppress the vote. Because when people don't vote, Conservatives win. Less than 18% of the eligible electorate voted for Doug Ford in 2022. For Ontario seniors, Doug Ford's tenure as Premier has been a literal nightmare. The Financial Accountability Office of Ontario issued a scathing report detailing the Ford government's healthcare spending, revealing that hospital capacity will considerably diminish by 2027-2028 due to surging demand, and that the province is allocating over $21 billion less to the sector. Doug Ford's deliberate underfunding in provincial healthcare and long-term care has meant more for-profit healthcare providers are providing care to medically vulnerable seniors. Many of these for-profit homes had some of the worst conditions and highest mortality rates during the early COVID-19 pandemic. But rather than punishing these homes, Ford made sure these for-profit long-term care homes continue to run and rake in historic profits. More than 4,500 seniors living in long-term care homes in Ontario died of COVID-19, along with 11 care workers in these homes in the first 2 years of the COVID-19 pandemic.
About the situation in these 5 long-term care homes, we should warn our viewers that the details you're going to provide are disturbing.
Yeah. They are, and there's pages of them. I mean, the report is a Canadian Armed Forces report that lists observation after observation, specific instances of things they saw, general things they saw that happened more frequently in terms of just like an isolated incident. We're talking about, I've got a list here, cockroaches, bug infestations, little or no disinfectant of the facilities, which is bad, never mind that we're in COVID, but especially bad during COVID. Soiled residents. So, basically residents not being changed or brought to the bathroom in time, and therefore they're sitting in perhaps diapers for long periods of time without getting changed. There was an incident or more than one incident of forceful feeding that led to actual choking and aspiration. They also talk about patients going weeks unbathed. That the staff there are untrained, or there's a lack of training, that there's a fear of using necessary supplies because they know there's a cost associated with those supplies. At least in one home, there was no crash cart, so nothing to help if someone goes into cardiac arrest. Expired medication, reuse of syringes, which is especially troubling. The list really does go on, Andrew, and patients it is very disturbing. And as you mentioned, this is in 5.
Yes, sorry. Patients with COVID, not isolated, wandering around. They were left in the same rooms as residents without the virus. The report that says that some residents were crying for help for as long as 2 hours before staff responded.
Yeah, it really is. When they say it's troubling or disturbing, I feel like that doesn't quite even capture it when you read this report.
And the news keeps getting worse. 200 seniors were turned out of a Mississauga retirement home with nowhere to go late last year. Thanks to limited oversight on housing for vulnerable people and a lifting of rental controls in Ontario by the Doug Ford government, more than 81,000 Ontarians are now homeless. Some housing advocates say the number is closer to nearly a quarter of 1 million Ontarians. Nearly a quarter of those without stable housing are seniors. And then Doug Ford had this to say about Ontarians who were experiencing homelessness. Quote, "You know what the best way to get people out of the encampments? To get out of the homeless? If you're healthy, get off your ASS and start working. Like everyone else, very simple." Unquote. How will medically vulnerable seniors do this, Doug Ford? Thanks to Doug Ford's elimination of rent controls, Toronto rents have increased 40% in the last 2 years. Even Ontarians working full-time or with several jobs have trouble making their rental payments. How will seniors on fixed incomes manage? The answer, they don't. Now, the number of Ontarians on the Ontario Disability Support Program, or ODSP, or on Ontario Works, who are now homeless, has doubled. The Ontario Health Coalition has taken legal action against the province of Ontario over the granting of a new 30-year license to Southbridge Care Homes, a for-profit company that owns Orchard Villa. Natalie Mera, the executive director of the healthcare advocacy group, said this, quote, "In case people have forgotten, it's one of the most notorious long-term care homes in the country. 206 of 233 residents contracted COVID-19, almost everyone, and more than 70 died. Unquote. Doug Ford has taken a wrecking ball to rent controls and regulations in long-term care homes. He's favoring for-profit homes that cut corners and put vulnerable seniors at risk. Doug Ford has made Ontario a dangerous place to grow old. Pierre Poilievre and Doug Ford have the same agenda. They want to usher in American-style for-profit healthcare that rewards their wealthy corporate donors. When they say they want to cut red tape, what they mean is they want to eliminate energy, utility, and home heating cost caps on homeowners and rent controls to allow big companies to take as much money from you as they can. Ford and Poilievre are for big business, not Ontario seniors. Doug Ford, his leadership, policies, actions, and inaction has reduced the quality of life for Ontario seniors. Get your mail-in ballot by searching Vote by Mail Application Elections Ontario. Ontario Election Day is February 27, 2025. Please vote Doug Ford out.